Hi, I'm Jonathan. I'm joined by my co-founder, Nate, and we are Decisive Health. Decisive Health is bringing the convenience of kayak.com to the healthcare world. These days, if I want to book a flight, I can go to any one of these sites, and at the push of a button, I can see all my options listed by price, schedule, or airline. If I want to book an MRI appointment, though, there are no such solutions for healthcare. Until now. Decisive Health is making it easy for you to find and compare your healthcare options. Healthcare is rapidly becoming a consumer-driven industry. And this is because 1 out of 3 employees is already on a high-deductible health plan. And this proportion is growing. As patients spend more out of pocket, healthcare is becoming a big-ticket purchase item for most households. And there are over 1 billion of these purchasing decisions happening every year. One of the biggest areas of spending is medical imaging. Each year, $100 billion is spent on medical imaging services, and nearly a quarter of this is coming straight out of patients' pockets. Despite all this spending, though, more often than not, patients aren't even the ones making the actual purchasing decisions. That honor goes to these people, the doctor's office staff. Now, unfortunately, these staff members need to do all their business by phone and by fax, so they don't have the time to consider patients' preferences, such as schedule or budget, when they're booking appointments. The result? Patients end up at overbooked facilities that charge 2 to 3 times as much as other places. Okay, for example, 9 years ago, I injured my knee playing soccer. Had to get an MRI. That's not me, but. Being new to the process, I simply went with my doctor's office's first recommendation. I ended up having to wait 4 weeks for my appointment, and I had to pay $1,000 out of pocket. Not exactly chump change for a poor graduate student. Now, a few years later, I injured my knee again. Time for another MRI. Only this time, I worked with the office staff to explore my options. We had to curate the options by phone, so it took us a week of going back and forth. But in the end, I got a next-day appointment for just 1/3 the cost of what the same MRI cost me a few years prior. Now, on the other end of this, medical imaging facilities are looking for patients like me. While I once had to wait 4 weeks for an appointment, the typical independent imaging facility has up to 20% of their capacity unused. Now, if they just filled this capacity with patients like me, they'd be looking at making an additional $10,000 in additional revenue every single week. Now, the problem is, though, these imaging facilities may have the state-of-the-art $3 million MRI machine, but when it comes to marketing, their state-of-the-art is literally mailing postcards. This has led to a crazy situation in which patients are desperately seeking information about facilities and who can accommodate them, and facilities are desperately seeking patients, but there's no good way to connect them. So Decisive Health is making that connection. We have created an online service where people can search for the medical services they need, and we connect them with affordable facilities that can provide them. Here's how it works. Suppose a patient has just been prescribed an MRI by their doctor. While the patient is checking out from their appointment, a staff member will go onto Decisive Health and enter the service that they're looking for. Next, we will show them a list of all the facilities in their area that can accommodate the patient. This list used to have to be curated by phone, but now we show all this information at the click of a button. The staff member can make sure that the facility's technical requirements meet the doctor's requirements. And for the patient, they can make sure that the appointment they make meets the patient's budget as well as their schedule. Once they have found an appropriate option, all they have to do is click, book an appointment, and the patient shows up. We have accomplished in 2 minutes what used to take an entire week. Now, for the imaging facilities, they get to fill their empty appointment slots with our patients, and all they have to do is pay our monthly subscription fee. Our initial market is New York City. Within an 80-mile radius, there are over 600 independent imaging facility options that we're signing up. And in fact, in 3 weeks, we signed up 77 of these imaging facilities, giving us 12% coverage of the area. Now, to drive patients to these facilities, we are marketing our tool to be used by orthopedic practices. This is because orthopedics account for 1/3 of all imaging referrals, and there are over 1,000 of these practices in the New York City area alone. Over the next 24 months, we'll be signing up 350 paying imaging facilities. This will give us annual recurring revenue of $1 million. We'll be booking appointments for 2,800 patients every month. And here's the team that is making all of this happen. Nate and I are both trained as developers, and we used our skills to develop and deploy our platform in less than a month. We have over a decade of experience in the healthcare industry, and most recently, we've been accumulating sales and marketing experience, selling healthcare IT products directly to physicians. We are also backed up by a team of key medical advisors. Their input helps us to continuously refine and improve our product. We are raising $750,000 to scale our sales and marketing efforts. Now, we're starting off in medical imaging, but our business model actually applies to all practice areas of medicine. In the end, it's the patient's health, and they're the ones paying for it. Decisive Health is giving them the tools to make better decisions on where they're spending. If you believe, like we do, that patients are what's going to drive the future of healthcare decisions, come find us. We'd love to talk with you. Thank you.